but a way of standing up is of course doing this. So it's a combined movement. But that's so complex, and you discover how complex this movement is, which is completely normal in daily life, if you divide it in small steps. Because then you have to think, hey, what actually happens? It starts with my head, and then am I going fully to the side? No, that's not what I do. It's like a combined movement. I go to the side, I bring myself up, I throw my legs out of bed, and I do this. And then in isolated small steps, what am I doing? Head here, step one. No, or head here, rolling to the side. Put my elbow here. I'm constantly using my abdominals. But just to find out how difficult this is.
Yeah, it is difficult.
By the way, what we are doing here, already about thinking in small steps, that's definitely what you will need during Parkinson's disease training. So what we discuss constantly, this applies specifically to spinal cord injury, but this will come back with stroke, this will come back with Parkinson's disease. So you should also see it from a broader perspective. But back to spinal cord injury, you're right, we constantly use our abdominals. And you might already have discovered that it's impossible to not use your abdominals, even if you want to. There's always abdominal activity. But the point is here, what if you don't have abdominals anymore? Then this movement will be impossible. And what if I roll to the side without abdominals? Imagine that is possible, then I'm lying here. How could I then come to a sitting position?
Push yourself.
Because my legs are not moving, I don't have any control over my legs in this position. I can maybe use my arm to lift myself up, bring my elbow here, but then. By the way, I'm using my abdominals here. If you feel my abdominals, there's just activity. So that is also another way. So how then? Now, and then what you've seen, then it's about first getting up into this position. And then bring your legs down. But that's completely different from what we are used to. So it's also different compared to what a patient with a spinal cord injury used to do. So the difficulties we or you encountered with dividing it in small steps will be exactly the same for the patient. So that takes time. Before we continue, have a look at how Reda's doing it.